One of the things we're not talking about enough during the COVID-19 pandemic is the impact it's having on the functioning of normal healthcare systems. What we know is we're seeing a hidden pandemic on the impact of patients with non-communicable diseases. When we look at key statistics, whether it's the utilization of emergency rooms, whether it's visits to healthcare providers, or the use of basic preventative care and preventative treatments, we're seeing significant declines. Some surveys have indicated 70 to 80% of physicians have seen reductions in healthcare visits. And that, of course, leads to bigger issues in many disease areas: cardiovascular disease, respiratory disease, and also, of course, cancer. Susanne, what is your perspective on the impact of COVID-19 on the care of cancer patients?
Yeah, Vas, I think you're absolutely right. And unfortunately, the situation in oncology is quite dramatic. I mean, a recent report of the WHO has stated that amongst 155 countries surveyed, 42% say that cancer diagnostic, screening, and treatment is delayed. And just to give you another number, in the UK, I heard recently that during COVID, 2 million screenings were missed. And unfortunately, we know what that means. Cancer is not waiting. And that means that if diagnostics and treatments are disrupted, this will lead to a poor prognosis. And that's obviously quite sad. But I think overall, there is also a tremendous psychological impact on these patients. Patients are afraid to go to the hospitals and medical centers in fear of contracting COVID. And we know, unfortunately, that it's true that they are at very high risk.
You know, the other area I think there's significant impact is in low and middle income countries where the burden of COVID-19 is significant. And my guess is the hidden pandemic will be significant there as well, as patients just aren't getting the care and treatment that they need in very stretched healthcare systems. Now, I'm also really proud about the efforts Novartis is making to try to overcome this challenge. I think you and your team have been doing some pretty innovative things.
Yeah, Vas. And I think our overall priority was during the whole time to supply our medicines to the patients in need. And that took quite some efforts. And it really required us to go new ways and really model completely new approaches like home delivery, like home monitoring, so that we could ensure patients receive the medicines they needed.
Now, one of the things I'm really proud of is all the different ways we've used digital solutions around the world. Whether it's our efforts with Tencent in China, we have collaborations in multiple other countries that are enabling us to reach patients and reach healthcare providers with the information and the medicines that they need. So I'm optimistic in the longer term that we can learn through this first wave of the pandemic on how to avoid the impact of the hidden pandemic on patients in need.
Yeah, Vas, and me too. I think we were able to mobilize a global response, and collaboration amongst industry, researchers, academia, patient advocacy groups was never as close as it was these months. And I'm very optimistic. For me, it is very important that when we now get a little bit out of the first wave, that pandemic preparedness has to include how we ensure that patients get their routine care also under pandemic circumstances, so that we can really make sure that each patient receives the care they need.
I'm super optimistic as well. We know what we need to do in the future to enable us to tackle pandemics. We know it's about great monitoring and data transparency. We know it's about preparedness in the healthcare systems, and we know it's about rapid response. Now I think we realize the fourth element has to be, how do we enable healthcare systems to function normally in this context? When you look at the data, we're seeing the kind of V-shaped recovery in physician visits, in the use of prescription medicines. So there's reason for hope that we can get back to patients the medical care that they need. And hopefully we can avoid this situation if we see future waves of the pandemic. And I think in the end, it's all about patients, right?
Yeah, absolutely. And I think I was quite proud what our associates have done and really went the extra mile to support patients in need. And I think that's what we also need to do in the future. Patients count on us, and that's what we have to deliver. And I really would ask all of us, what can we do collectively to ensure that patients can have better and longer lives?